Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com, and today I'm going to talk to you about what you would do if you had a heart attack and you were on your own. It's something that a lot of people worry about, and the British Heart Foundation research has shown that somebody in the UK has a heart attack every 3 minutes, and so it's something that could happen to absolutely any of us. So the key things that we're going to go through are, first of all, I'm just going to explain the difference between angina, a heart attack and a cardiac arrest, because that's something a lot of people get confused about. Then we're going to talk about the signs and symptoms of a heart attack, so how you might realise that you are having a heart attack, because the symptoms aren't always as obvious as you think they might be. And then we'll just go through what you should do and what's sensible if you're on your own. Okay. So key thing is, angina is a narrowing of the arteries, the coronary arteries around your heart. And if they're narrowed, it means that if your body needs more blood for some reason, so if you're running or you're stressed, then the heart will be beating faster. If it's beating faster and the coronary arteries that supply the heart are narrowed, then you will find that you can end up with sort of cramp in your heart, which is what angina is. It's the heart muscle saying, help, I need a bit more blood. So that is angina. Now, with the narrowing of the arteries that's caused by cholesterol or some other deposits, fatty deposits that happen in there, the blood will slow. If the blood slows, the blood can clot. If the blood clots, then it can actually block or occlude the whole of the coronary artery. If the coronary artery is blocked, the heart muscle at the end of it will not get the blood supply that it needs, and that heart muscle will die. So a heart attack is when a portion of your heart muscle dies because it hasn't got enough blood supply. And if it's a big blood vessel, it might be a catastrophic heart attack. If it's a smaller blood vessel, it might be a more minor heart attack that could put your heart into a different rhythm and make you feel very ill. A cardiac arrest is when you have either a very severe arrhythmia of your heart, possibly caused by a heart attack or caused by something else, or that the heart actually stops beating, or it isn't beating sufficiently to transport the blood around your body and to your lungs and to your heart, and everything will stop. So that is a cardiac arrest. So I hope that's helpful. Okay, how might you recognise that you are having a heart attack? So signs and symptoms of a heart attack, people usually go, oh, crushing chest pain. Well, over 50% of the population will not experience that sort of heart attack. They might have pain down their jaw, they might have pain in their arm, usually down the left-hand side, or they may have no pain whatsoever. If you're a postmenopausal woman, or if you are diabetic, the chances are you won't experience pain. For the diabetics in particular, it's because the nerve endings are not as receptive as they would normally be. Okay, so don't count on that pain. And also, if you do get the pain, it might feel more like indigestion. So don't just assume it is indigestion, because if you feel seriously unwell with it, it probably isn't, or it might not be. So get yourself checked out, because time is muscle. And the longer you leave it, the less chance you have of making a full recovery. So always phone the emergency services if you think you might be having a heart attack. So other signs and symptoms, you might be pale, cold, clammy, feeling sick, feeling thirsty. They talk about a sense of impending doom when you feel incredibly ill. If you are feeling really ill and really worried, then get help. Okay, so how do you get help? Please, please, please don't drive to A&E. If you're feeling that ill, you could end up getting worse as you are driving and kill yourself or kill somebody else. So please do not be tempted to drive to A&E. Phone an ambulance and phone a friend as well after you've phoned 999. And phone a friend or a relative who can come and sit with you and be with you whilst you're waiting for the ambulance. Unlock the door, turn on the light, and sit yourself somewhere comfortable in a lazy W position if possible, so with your knees bent up, if that's a comfortable position to be in. keep yourself warm, so grab something before you sit down, and relax as much as you can. So it might seem a silly thing to say, but just relax. The emergency services are on the way. Make sure before you sit down that you have your GTN spray and your 300 milligram aspirin if you have been prescribed one for this sort of emergency. Take your GTN spray and you would spray it under your tongue, or if it's a tablet, GTN tablet you've been given, you would chew it or crush it, because then it goes straight through into your buccal cavity underneath in your mouth, and it goes much faster into your bloodstream that way. If that hasn't worked in 2 to 3 minutes, at about 5 minutes you can take an aspirin, and that's the aspirin that you would crush or chew. So first of all, your GTN spray, because that will relax your coronary arteries and let the blood supply go through. And if that hasn't helped, you would then chew an aspirin. Stay as calm as you can. The emergency services will be coming, and as soon as they get there, then they will ship you off and check you. They'll probably do a 12-lead ECG so they can see exactly which part of the heart is affected if you are having a heart attack, and they will be nice and reassuring, and then they will take you off to the hospital to be checked out. I hope that's helpful. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.